Have you ever wished you could get the health benefits of fasting? Like weight loss and better blood sugar control, without having to completely stop eating? Dr. Jason Fung, a nephrologist and world-renowned expert on fasting, says that's exactly what the fasting mimicking diet offers. Instead of relying on sheer willpower to go without food, this approach provides carefully designed meals that trick your body into believing it's in a fasted state. The science behind this is fascinating. It lowers insulin, activates repair pathways, and promotes fat burning, all while you still get to eat. Many people fail at water fasting because hunger and fatigue make it unbearable. But the fasting mimicking diet gives a structured, safer way to enter the fasting zone. Today, we'll break down how it works, why nutrient sensors like insulin and mTOR matter, the benefits shown in research, and even what real patients have experienced. By the end, you'll know the pros and cons and whether it might be worth trying. 1. How the fasting mimicking diet works. The fasting mimicking diet, or FMD, is usually a 5-day program where calories are cut by about 40 to 50% compared to normal eating. According to Dr. Fung, the meals are deliberately low in protein and sugar but rich in healthy plant fats, like nuts and olive oil. This nutrient balance keeps insulin levels low, which is critical because insulin is the storage hormone that blocks fat burning. By keeping insulin suppressed, your body shifts into ketosis, where it burns fat for fuel, just like with water fasting. Another key effect is the activation of autophagy, a cellular recycling process that clears out damaged proteins and organelles. This is one of the reasons fasting has been linked to longevity. Unlike water-only fasting, however, FMD provides micronutrients to keep you from feeling depleted. People report less hunger, fewer energy crashes, and better compliance overall. Dr. Fung points out that this structure makes it accessible to patients who would otherwise never attempt fasting. 2. Why lowering nutrient sensors like insulin and mTOR matters. Dr. Fung often explains that our bodies are constantly flooded with food signals, especially in the modern era of snacks and processed carbs. Insulin, when chronically elevated, locks fat inside cells and drives insulin resistance, a hallmark of type 2 diabetes. Another pathway, mTOR, is triggered by amino acids, especially from protein, while short bursts of mTOR are useful for growth and repair. Constant activation accelerates aging and even increases cancer risk. The fasting mimicking diet helps switch these sensors off for a few days, allowing the body to reset. When insulin and mTOR are down-regulated, the body can focus on repair instead of constant growth. This metabolic shift lowers inflammation, improves mitochondrial efficiency, and enhances fat metabolism. In the long term, cycling through periods of lowered nutrient signaling may reduce the risk of diabetes, cardiovascular disease, and neurodegeneration. It's not just about eating less, it's about giving your body the signal to heal. 3. Health benefits shown in studies. Dr. Fung frequently cites the groundbreaking research of Dr. Walter Longo, who pioneered the fasting mimicking diet in clinical studies. In human trials, participants who followed FMD for 5 days saw reductions in belly fat, blood pressure, and cholesterol. Blood sugar levels improved significantly, especially in people with prediabetes or type 2 diabetes. Animal studies went even further, showing reduced tumor growth and extended lifespan in rodents that underwent repeated FMD cycles. Dr. Fung points out that these findings mirror what he sees in his patients: improved insulin sensitivity, better metabolic markers, and often a sense of renewed energy. Importantly, FMD seems to preserve lean muscle mass better than long-term calorie restriction, which makes it safer for older adults. The benefits are not limited to weight control, it's a whole body reset that touches the immune system, cardiovascular health, and even brain function. And because it's just 5 days, it's practical to repeat a few times a year for lasting effects. 4. Real patients' experience. Beyond research, Dr. Fung has observed how patients personally respond to the fasting mimicking diet. Many report that the first day feels like a normal low-calorie diet. But by day 2 or 3, their hunger diminishes as ketosis kicks in. Some describe improved mental clarity, better focus, and even reduced joint pain as inflammation drops. Others admit the meals can feel repetitive or bland, but say the structure helps them stick with it. A few patients struggle with mild headaches or fatigue, but these usually resolve by day 3. Interestingly, many said they felt more in control compared to water fasting, since they were still eating something. One common theme is surprise at how quickly bloating and water retention disappear. By the end of the 5 days, most notice slimmer waistlines and steadier energy levels. These stories show that while it isn't effortless, FMD is much more approachable than traditional fasting. 5. Pros of the fasting mimicking diet. Dr. Fung highlights several strengths of the fasting mimicking diet. The structure makes it user-friendly. There's no guessing about what to eat, since everything is pre-planned. Because you're still eating, adherence rates are much higher than water fasting, which is notoriously difficult. The micronutrient support reduces the risk of deficiencies and side effects like dizziness or weakness. Another pro is that the program only lasts 5 days, making it far more sustainable than long-term calorie restriction. Patients don't have to give up their social lives for weeks or months. Just commit to a short reset a few times a year. The meals are also plant-based, aligning with broader health recommendations. For those intimidated by fasting, FMD provides an on-ramp to experience its benefits without the shock of 0 calories. It's essentially fasting with a safety net. 6. Cons of the fasting mimicking diet. Despite the benefits, Dr. Fung is clear that FMD has downsides. The most obvious is cost. Commercial kits can be expensive, often hundreds of dollars for just 5 days of food. Not everyone enjoys the taste of the prepackaged meals, and some find the portions small or unsatisfying. While hunger is usually manageable, a few people still struggle with fatigue or irritability. Because it's a standardized program, it may not fit every individual's needs. Patients with diabetes, kidney issues, or on medications should only attempt it with medical supervision. Some critics argue that fasting shouldn't be monetized, since water fasting is free. Another limitation is that while FMD mimics fasting, it might not trigger all the same biochemical pathways as true fasting. Finally, long-term research in diverse populations is still limited, so we don't know if the benefits hold across all groups. It's a promising tool, but not a magic bullet. The fasting mimicking diet represents an exciting middle ground between eating as usual and strict water fasting. Dr. Jason Fung emphasizes that while it's not perfect, it provides a realistic way for people to tap into the healing power of fasting. By lowering insulin, suppressing mTOR, and activating repair pathways, it gives the body a chance to reset. Research and patient experiences alike show benefits for weight loss, diabetes, and overall vitality. But like any health strategy, it works best when combined with a nutrient-dense diet, regular exercise, quality sleep, and stress management. If you're curious, talk to your doctor before starting, especially if you have existing health conditions. FMD may not be cheap, but for many, the trade-off is worth it. In the end, it's about giving your body space to heal, without feeling like you're starving.